Okay, so now, all right, great. Well, welcome you guys. It's part 4 for Keto Diet and Mood. And so today I'm Dr. Joanne Gordon, and we're going to be doing, talking about medication. So this week's chat with Dr. Georgia Eid. She's the doctor that I'm getting trained with. She's a psychiatrist that practices in Massachusetts. And I was hoping I'd get to see her, but she actually is a couple hours away. And it turned out she's actually visiting her mom this weekend too. It's pretty fun. And but anyway, she's a fabulous physician, psychiatrist, and very open to all the things that we're doing here, and works with a lot of different doctors, naturopaths, licensed massage family therapists, as nutritionists, so all different types of practitioners on the call, just really trying to get the word out about the importance of keto diet and mood. And I think it's a really important topic, especially for our age, but adults, but also for children. Like I said, I'm visiting my family this weekend, and there's a lot of sugar going on in my family, and I think a lot of the kids are sometimes can be a little bit more rambunctious. And my son, he was allergic to eggs, and when he was young, I really had him off wheat, dairy, and sugar, and eggs. And I never had terrible twos. I'm like, he might have had terrible 21, but never had terrible twos. And I really think it has a lot to do with what we're feeding our kids. So, but a lot of times we're going to focus today on some of the medications that people are taking and how the keto diet can affect that. So here we go. So I just made a couple of slides. I didn't actually make many. I just made like 4 or 5. Let's see if we can get this to move. All right, so here, so metabolism and medication. So the medications and your metabolism actually work together. So the keto diet can cause shifts in your brain and body chemistry. And so I definitely have noticed this for sure in my own life. I started using a low carb and keto, low carb and paleo really with my patients, and really didn't until I realized that the keto diet can have an impact on the brain health. I started really cutting back on my carbs and noticed a tremendous difference actually. But it turns out that, and patients I am certainly not a psychiatrist. I don't prescribe psychiatric medications, but oftentimes patients will come in already taking them, and they'll come in taking oftentimes antidepressants and things like that. And so some medications are more keto friendly than others. And so it was really interesting to learn about some of these medications. And we're not going to go through all the medications, but just get a general idea, because some of you might be on one of these medications, and also you may know somebody. And so one thing that the keto diet, which is really interesting, there's been some studies on people with psychiatric disorders, and especially there's been a ton of research on epilepsy. And what they found is that that research can actually translate into other types of disorders, such as bipolar disorder. What else? It can be done, anxiety, depression. And so there's more and more research that's starting to come out now in regards to some of these disorders. And I actually find that when I follow a more ketogenic diet myself, that I feel better mentally and emotionally. And it was very interesting to learn that some of these medications are very safe to take on a ketogenic diet, and some of them are not very safe to do on a ketogenic diet. And we'll talk about a few of them, but also that, a lot of these medications will cause weight gain. Some of them actually cause weight loss, and some of them you could stop immediately, and other medications you have to wait 6 weeks. And Dr. Eid, she talks about, when you're doing the keto diet, you really don't want to make any changes for about 6 weeks. It takes about 6 weeks to find your new normal when you're on the medication and on the diet. And so unless you find that, okay, yeah, we definitely need to make a change, it's best to find that new equilibrium, which takes about 6 weeks. And I myself have found it, like my goal is to actually do a keto diet, like maintain ketosis for 6 weeks. And of course, I haven't done that yet. But I think that's normal, but also just to be able to, me, myself, try to see what it's like to actually do that. And if you're interested in joining me, well, let me know, because we can have a little group on trying to do a keto diet where we maintain a little bit of ketosis for 6 weeks and really see the benefits from it. So I'm excited for that. But oftentimes patients will come in on antidepressants. Antidepressants are one of the most commonly prescribed medication. The use has gone up, I think I wrote in my email, like 35% over the last 5 years. And so every year there's more and more antidepressants being prescribed. Antidepressants are Prozac, Zoloft, Celexa, Lexapro, things like that. These are called the serotonin reuptake inhibitors. And it turns out they're actually very safe to take while you're on a keto diet. The problem is that these SSRIs do cause some weight gain. But it turns out that there are some antidepressants that are not SSRIs. There are different types of antidepressants that work in different ways. And they'll actually cause a little bit of weight loss. And so Wellbutrin is one of the ones that can actually help with weight loss. And so other medications that can cause weight gain, actually the stimulant that are very safe with the keto diet, I should say, is that the stimulants. So sometimes people are taking Adderall or Ritalin, Dexedrine, things like that. These can actually cause a little bit of weight loss. And that's because they reduce appetite and they're and therefore people aren't eating as much. And turns out that these types of stimulants will actually stimulate more dopamine and norepinephrine in the brain, whereas she didn't really talk about the SSRIs. Oh, well, the serotonin reuptake inhibitors affect serotonin, right? But the stimulants like for ADHD, so to speak, will increase your dopamine and norepinephrine, causing you to not have as much of an appetite, and actually you'll be able to make more ketones easier. So that's good. So if you're doing a keto diet with those medication, it can actually work in your favor, and it's very safe to take. And what they do find is that when you're doing a keto diet and you're taking a medication, oftentimes people will find that they need less medication because they become more sensitive. And I know for me, like because I try to do the keto more often than not, that I do find that I am more sensitive to certain things. And I don't know if alcohol is one of them, but I did have some alcohol, I think last weekend, and it did affect me. But they do say that all these different medications will become more effective, or you're more sensitive to them. The other medications that's pretty safe to take while on a keto diet is the benzodiazepines, and these are the ones that are pretty much prescribed for anxiety and sleep. These medications are like Ativan and Xanax and Valium. And so these medications actually stimulate the GABA neurotransmitter, and GABA neurotransmitter is one that's very calming. And a lot of times medications will, they'll try to increase GABA, but we talked about in the first class how sometimes if you're on a high sugar, high carb diet, that your glutamate neurotransmitter, which is actually very excitatory and causes a lot of irritability and so forth, can be high. And so when we give a medication that increases the GABA, which is the counter regulatory one for that, then that helps balance it. But the keto diet actually will help reduce the glutamate, therefore in effect cause slightly more GABA relative to that. So, but the good news is that the benzodiazepines don't affect metabolism, and that you can, again, if you're doing a keto diet, that you may be able to reduce your dose after 6 weeks or so. So that's kind of interesting. And so there were other medications that she talked about. If you have questions about some, you can ask me, but I don't feel I know the medications well enough like the antipsychotics. I don't really see that many people on them, but antipsychotics can cause actually significant insulin resistance. And so you have to actually monitor the patients a little bit more. So I thought for today, I would go over more of the ones that are pretty safe to take. But one that I did want to say that's for diabetes, when you're on diabetic medication, so some of my patients come in on diabetic medications, these new medications, they're called SGLT2 inhibitors. And these types of medications actually remove the glucose from the blood right away. And so, and you're excreting them. So you can't actually do a keto diet if you're on one of these medications. It can put you into very low blood sugar and cause significant problems. And then if you're taking insulin and sulfonylureas, so these types, so if you're taking insulin, you have to be careful if you're on a keto diet because your need for insulin is greatly reduced. And so you have to just be very cautious on that. And the sulfonylureas actually help your body make insulin. And I was always taught that these medications aren't the best because they can actually burn out your pancreas earlier. So you're making more insulin than you might not necessarily, well, you probably need it, but if you just lower the carbs, then you wouldn't need as much of that, much insulin. But the most common diabetic medication that is being used is metformin. And I like that one because that metformin just helps improve insulin sensitivity. And it's actually very safe to use while on a keto diet. But we will monitor as well and then lower the dose as needed of metformin. And so that one I feel very safe working with. I'm not a diabetes doctor by any means. And so when someone's on insulin, I take a very cautious approach and make sure they know how to adjust it or talk to their doctor as well. But if we can get off the sulfonylureas, because I think those, again, do increase insulin secretion of the pancreas and cause pancreatic burnout. So it's better to address the issue through diet if you're able to. So sometimes if your blood sugar does get too low, I wanted to share with you the symptoms of low blood sugar. It kind of feels like you're having a panic attack sometimes, but it can cause anxiety, nausea, shaking, sweating, dizziness, headaches, hunger, can cause an increased heart rate, confusion, and even poor coordination. Now, I know that sometimes when we're doing some intermittent fasting or doing a 24-hour fast or a 48-hour fast, we may encounter some of that. I've certainly have had a headache doing some fasting. And so just to be aware of that. And if you need to, have a little bit of something to eat, or, I know when I was, sometimes electrolytes can be very important. But if you're having significant low blood sugar and you're diabetic or your blood sugar is dropping too low, it's very important to take that into account and see the symptoms, number one, and then have something to eat. So, and that might have been my last slide. So I didn't do very slides. So I'm going to actually stop the screen sharing. Stop the share. There we go. So I'm going to try to get better each time with the classes so we can have more slides to help us along. But some of the other medications that can be affect your blood sugar is some of the blood pressure medicines as well. And so, which I didn't realize that some of the blood pressure medicines that I certainly see some of my patients on are beta blockers, statins. So statins, the cholesterol lowering drugs, those will actually cause some insulin resistance. And she said that they damage your beta cells, which I didn't really know it damaged the beta cells, but the statins I know can actually, cause people to have more insulin resistance and cause diabetes when they're actually trying to, get, usually people are on cholesterol medication because they have high cholesterol, which is due to high blood sugar. And then they give them the statin, which, over time definitely causes more high triglycerides and insulin resistance and promotes the problem. So, but also some of these diuretics can also cause some insulin resistance. And so there's different medications. So the thing is with the keto diet, if you are on any medications, to please be cautious. And, if you need to contact me, please do. And we can work together, excuse me, with that. And then, so the keto diet is a medical thing. If you're healthy, then it's pretty okay to do. One of the side effects that I've noticed is sometimes I have, because I eat more fat, I'll notice that I'll get a little bit more gallbladder issue. I just feel like I need a little bit more help sometimes with digestion. So that can be a side effect, but most of the time it's pretty safe. So I just really wanted to spend the time today and just, that was let you know about some of the medications. And she talks about how it does take about 6 weeks to find that new normal. So if you're taking on the keto diet, you want to wait about 6 weeks before you make any changes in medications unless needed beforehand. So you want to, and then you always want to taper slowly off the medications as needed. So that was kind of fun. And so I want to open it up to questions, because that's really all I had on the medications. There were, like I said, more medications that she talked about, but I felt like some of those were real, anticonvulsants, antipsychotics, which I don't see too much in my practice. And so that means most of my patients aren't on those. So I didn't feel like that was so important to go into at this time. So I wanted to open it up and see if we could talk more about your experience on the keto diet, if you've been trying it or not. I know Rita said that she's been doing a little bit more, trying new foods and liking them and seeing some benefit from that. Because I know it can be, I'm here to support you as you try to cut out carbs and reduce sugar and try to be more mindful of what you're eating. So.
Does the keto diet affect the thyroid medication very much?
Yeah, that's a great question, Kathy. So out of all the hormones that I tend to prescribe, oftentimes the thyroid is one that I will lower because people's metabolism improves while on the keto diet. So usually I see I may adjust the thyroid medication while someone's doing the keto diet. And yeah.
So how does the metabolism improve? What do you mean by that?
Yep. So when you're doing a keto diet or also doing some intermittent fasting and things like that, your body's switching from using glucose as its primary fuel to using ketones. And so if you're eating all the time and eating carbs all the time, your body just uses the glucose that you eat. But in order to shift away from that glucose, it has to, in order to get into ketosis, it has to shift gears, and they call that like a metabolic flexibility. And so when your body is able to shift and become more metabolically efficient, then your metabolism is improving. Does that make sense?
So you become more metabolically efficient on keto.
Mm-hmm.
So I have a long-standing practice of doing 24-hour fast every week. So like a couple of years.
Yeah.
And that would probably make me metabolically more flexible also, wouldn't it?
Yes. Yep. It definitely does.
Because my body's already used to doing that.
Right.
Occasionally.
Yeah.
Okay.
Yeah. I think it's a good practice. And I noticed when I ran a group, we did a 24-hour weekly fast. Every week we did it for 3 months. And I still do it, but not in a group setting. And that was one of the things that I noticed, is that it really helped shift me over to, my mood, it helped shift my metabolism, and it also helped break that set point. Our body likes to be at a set point, and sometimes in order to break that pattern of always being at a certain weight, you have to kind of get metabolically shifted, which can take time. Yeah. So one of the hormones that I will often reduce is thyroid. So, yeah.
Now, is that true for someone who has no thyroid at all, like myself?
It could be. I mean, definitely you might not need as much medication. I mean, everyone's different, so it's hard for me to be like, oh yeah. But it could be that your cells are being more efficient. I mean, it's, just because you don't have a thyroid, I think that everyone's thyroid dose is different. So, yeah, so maybe we'll see some changes there. That'd be good. Excellent. Okay. I'm gonna mute you back. But any other questions? So I'm not going to stop the recording because I learned how to cut the videos. All right. So some of the other things that we learned, let's see. So I thought one thing that we learned was that for ideal body weight, one of the formulas that came up in the notes was for women, the first for your 5 feet, 100 pounds for the first 5 feet, and then every so it's 100 pounds for the first 5 feet plus 5 pounds for every inch over 5 feet. So if you're 5'3", the optimal weight for this formula would be 115 pounds. So I thought that was kind of interesting. And for males, it's 106 for the first 5 feet, and then 6 pounds for every inch after 5 feet. So does anyone have any trouble finding like which different foods to eat at all? Like having questions about food choices?
Joanne, this is Crystal. I do have a question about the 5 feet and 100 pounds.
Yeah.
Does that take into consideration your age, like each decade?
It doesn't take anything into effect other than your height.
Wow, that's really hard because years ago I remember everybody was thin and that was easy, but nowadays people are not thin at all.
No, exactly. Yeah, so let's see, I'm 5'7", so I should be 135, is that right? So I'm still overweight then.
Wow. I mean, that's going to be tough to get to that weight.
Yeah, it was just a formula that I saw that I thought was interesting. But then last time we talked about calculating our daily protein requirement, and I think I really like that because I really feel that when we get enough protein in our diet, our cravings go down, and also it does help with weight loss. And that one here was multiply ideal body weight in kilograms by 1.2. So they say it's like 2.2 pounds per kilogram, and then times 1.2. So for a 150-pound person, it comes out to around 100 grams of protein a day, which I think was interesting because I think a lot of people don't get enough protein in their diet. And as we get older, we become sarcopenic, which means we get muscle loss. And so in order to maintain healthy muscle mass, we need to make sure we get enough protein in our diet. So I thought that's one of the things I've been really talking about with a lot of my patients lately, is just really getting enough protein. And I think that helps quite a bit with the cravings. Mhm.
Joanne, this is Terry.
Hi, Terry.
Can you, this is the first time I've been in one of these, but if what you're talking about, I'm 6 foot and about 180 pounds overweight. Actually, I usually feel comfortable about 15 pounds lighter than I am right now.
You're breaking up a little bit.
So the keto diet is trying to cut the carbs, which is something I do because I've been diabetic. I'll have to do a little more research into it, but you know, I found that it's easier to keep my blood sugar down if I, you know, stay away from.
Oh, I guess he put himself off the call. Oh, there he is. Okay.
Yeah, my phone actually is buffering every once in a while, so this sounds interesting because it's something that I kind of already do and just need to research into the keto part of it a little more.
Yeah, I think it might be good for you. Okay. Terry, I think your phone is really breaking up. Yeah, here we go.
Yeah, I think you're right. All right, I'll let you go back.
Okay, let's talk soon, okay?
Okay, yeah, and actually I've got a phone call in just to talk to you. I've been bleeding again. The medication you gave me made me stop for almost a week, but now I'm back bleeding again.
Okay. We'll take that offline, okay?
Okay.
Thank you. Okay, good. All right, yeah, so yes, so I think the keto diet actually can be very helpful for diabetics. And so with diabetics, the main problem is too much sugar and too much carbs. And so when you're on a diet that lowers that, then you can really help lower the metformin and lower, you know, your diabetes medications and really improve your health. Yeah.
So I did the math on my ideal weight. I'm 6'1".
Yeah.
Said I should be about 185. I'm at like 174.
Oh,
So
okay.
I mean, and this is after joining you with that fasting group,
Yeah.
which dropped me 20 pounds over 8 months, which was a slow rate, which I think is okay. But so am I too low?
Oh, I think I think you feel comfortable.
I feel great at this weight.
Yeah. So I would just, yeah, I know you feel great, and I wouldn't be like, oh, you have to put on weight. I would just, make sure that you're getting all the proper macronutrients, so to speak. So getting enough protein, limited carbs and vegetables and fats.
Yeah, I've been adhering to the keto almost completely. I'm doing great.
Yeah. No, I think you're good.
And my wife, who's not doing this because I'm the cook, has lost almost 27 pounds. So she's happy too.
Yeah. Yeah, that's good. You can kind of sneak it in. You don't have to even know, because all you're doing really is eating real food.
Yeah.
So, yeah. So it's pretty exciting. I think, like I said, what motivated me with this class is because when I was doing like more paleo and whole foods, and when I was following Dr. Jason Fung, and he was saying, white rice was okay in a way because it's a whole food and it doesn't have fructose. A lot of Chinese people, Asian people will have white rice, and anyway, I was still continuing that. But when I found out about keto and mental health stuff, and I increased my protein, and stopped the rice, I noticed a significant improvement in how I felt. And I feel that it definitely has affected my practice in the sense that oftentimes people come in with pain problems, and their pain, when we adjust the diet, it gets better. And then actually the other week I had a patient, she came in for her a situation, and I've been working with her for about a year now, and doing low carb keto type of work. I never actually called it keto because I didn't start doing keto till a couple months ago. And but everything has gotten better on her, and she said that she stopped taking one of her psych meds. And of course I mentioned that I was taking this class, and she goes, well, I'm not seeing you for my mood or anything. I said, I know that. And then later on, she actually told me that she stopped taking one of her medications because she felt like she didn't need it anymore. So it definitely can affect your mood. And I think people just don't realize that, if they're thinking that they're, like me, I was, kind of bitchy or depressed or, things like that. And how much of an effect it can have. And when you're working with a psychiatrist, you really see sometimes people have severe emotional problems like suicide risk and things like that. And when they change their diet, that, those kinds of thoughts go away. Yeah.
So in what ways are you feeling better on keto?
So I'm doing more keto, more from my mood, because like I said before, I was, well, my big thing was about 5-10 years ago. I remember coming home and I met my girlfriend, and we went out and I ate all this bread at, the restaurant. And I just remember significantly that weekend just being mad at everybody and just being kind of bitchy. And then when I went home and cleaned up my diet, I realized that, when I got back in my routine, like how much I had some anger issues, and so I noticed it back then, but I didn't really make the connection significantly, even like with rice and like all the other carbs, because I was always for 20 years promoting no wheat, gluten-free, sugar-free, dairy-free. I said that for 20 years. And, I also smoothies, I did smoothies for 20 years, and realizing that, the smoothies really increase your sugar, your insulin, and even a lot of the carbs will increase your insulin, and learning how that affects the brain because our brain can become insulin resistant because the glucose can just go right into the brain, but it needs insulin to get into the cell. So if it doesn't get into the cell and the brain becomes insulin resistant, the brain, the glucose kind of hangs around and it causes inflammation. And so since, there's a whole new emerging field called metabolic psychiatry, which when I heard about that and how it affects the brain, I just was like, oh my God, it was just really, felt like after 50 years, I really feel like, as a naturopath, I'd never wanted to go on an antidepressant, but sometimes people would say, you should go on an antidepressant, but I'm like, oh, I can do it with my diet and all these different supplements. But I really feel that when I, that's why I want to do like a 6-week keto, because the Dr. Ede says, you really takes that 6 week, because I still cheat, here I am on vacation. And so I'm cheating. And, but if I feel like if I can do a 6-week stretch and get support from people like you, then I think we could do it together and really possibly make a shift. But I do definitely notice that. And I see it in my family. I notice that, like I was just at my brother's house, and there's a lot of sugar going on in there. And the place was just, people screaming and, very active. And I noticed that, that I feel better when I don't. And, no one wants to listen to me. I'm just the sister. or, you know, no one really wants to listen to me. So I figure I'd help other people.
I have a question about sleep apnea. I don't know much about, I haven't listened to this enough on TV,
Yeah.
but I was hearing that your brain can become insulin resistant, just like you were saying, and it can kind of have symptoms of like prediabetes. You can have kind of symptoms of prediabetes, restless legs, and then the sleep apnea starts up, and it might, does keto help sleep apnea?
I think it can. I mean, there's no research to say, oh yeah, keto helps with sleep apnea, but it definitely reduces inflammation. And I've seen sleep apnea, you know, definitely improve when people lose weight. Sometimes when they remove dairy, sometimes because dairy can be very kind of phlegmy, but definitely from an inflammatory standpoint, it could help for sure. It improves sleep for sure in general, because all my patients that if they have trouble sleeping and they're eating carbs, I say, well, at least don't eat any carbs at night. Because if you eat carbs at night, that it will help keep you awake, you know. So one of my patients, she was thinking, why? She was like, oh, I thought it was good to take carbs at night. You know, she was eating potatoes and, you know, whatever she was eating, like more carbs at night. And I said, no, don't do that. That's not right. And so she switched and she's been sleeping a lot better. But I know if I eat carbs, sometimes, you know, and some people are more sensitive than others. And I don't want to say after 2, but I definitely try to, well, I'm trying not to eat any carbs, right? But if I eat, I don't eat them at dinner. If I'm going to eat them, I might have, you know, a bite, you know.
That's interesting. My wife craves carbs at night, and she eats when, you know, we do real well during the day, but then she eats a lot of carbs at night and she has trouble sleeping.
Yeah. So
I'll try
maybe
and talk
mention
to her about that.
Yeah. And me, I don't know, the other night we have these CBD gummies for sleep with some melatonin in it, but the gummy has sugar on it. And so, and I don't like to take it, you know, but I don't know, I figured, oh, let me try this. And I woke up and I was wondering, is it because I'm more sensitive now to the sugar than I was before, you know? So, but. So.
Now, you had mentioned that a person should eat more protein, especially, you know, with the evening meal, like 8 ounces, in my case, 8 ounces of meat of some kind, probably.
Yeah.
Is that help you sleep better because it keeps your blood sugar just stable up instead of you go up and then you crash in the middle of the night and then you're hungry and that wakes you up even though you don't know you're hungry?
Right. Yeah. So yeah, the protein is definitely more stabilizing for your insulin than, you know, than carbohydrate for sure. So yeah, because the carb is going to spike your insulin and then going to drop your, you know, versus protein is definitely more steady state.
Because I have a lot of trouble with insomnia. I wake up around 2, but I never know that I feel hungry. But I was listening to something on TV where the guy was talking like you're hungry is part of what's waking you up.
Yeah.
You know, maybe you don't get enough protein to kind of keep your blood sugar up.
Yeah. So I always tell people if you're going to eat something at night, have it be like a protein or a fat before bed rather than a carb.
Mm-hmm.
Yeah.
One of the things that I find is if I eat light, you know, like just before I go to bed, I sleep better all the way through the night. Maybe that's because that protein lasts all the way through the night into the morning, and then you don't get hungry.
Right.
And I don't eat a lot of carbs at night. I tend to eat them in the morning because if I'm going to eat some carbs, I know that if I eat them in the morning, I get an opportunity to burn them off.
Right.
That's the thing I've kind of found is I can get by with a little bit of carbs if I have the activity to burn them up. If I don't, they really spike my blood sugars.
Yeah. I'm going to make a comment there. So yeah, so oftentimes you are more insulin sensitive in the morning than you are at night. So you're more insulin resistant at night. So that's why it is better to eat your carbs. If you're going to have carbs, it's better to have them earlier rather than later, because your body will be more insulin resistant later. And Dr. Jason Fung talks about that. He says better if you're going to do intermittent fasting, it's almost better to do like lunch to lunch rather than dinner to dinner because of the earlier time that you're eating. It's just our culture says, eat late, the dinner meal is more social, but it is better to have your dinner to be a little bit earlier rather than later.
Would you clarify that? You said intermittent fasting, lunch to lunch. What do you mean by that?
Yeah, so if you're going to do like a 24-hour fast or have your last meal of the day be earlier in the evening rather than later, because you're more insulin resistant later. So sometimes some people will eat their last meal at 4 or 5 o'clock rather than at 7, 8 o'clock, right? So seems to be a little bit better.
And what is this about the 6-week program? You were saying something about the 6-week program.
Yeah, so they say that to maintain ketosis over a 6 weeks period of time is a little bit, that's where you notice most of the benefit. So when we were in class, because I've never actually maintained ketosis for a week, I mean, I'd be lucky if I maintained it for 3 days. And so I didn't realize, like from a depression point of view, like, gee, maybe I'm selling myself short. I'm really not seeing the full benefit of the keto diet because I only maintain ketosis maybe a day or 2 at a time. I'm not monitoring myself and whatnot. But if I could maintain it for 6 weeks, what would I wonder well, how would I really feel? Like what would be the real benefit of that? Because there are studies to show and to suggest that it takes about 6 weeks time to get the full metabolic accommodation, so to speak.
So once you make the 6 weeks, you continue it, but it's easier, right? To maintain it?
Yeah. And you end up, what Georgia was saying is you end up, some people feel really good because you can measure your ketones, usually I think anything above 0.5 is ketosis, up to 3.5 to 4. You can go up to 5, but that's too much. So between 0.8 to 2.5 say. And so some people get real specific. They say oh, I feel really good when my ketones are at 1, or someone else. I have a girlfriend, she doesn't get any benefit until her ketones are at 2.5, so you start to learn your body's own personal metabolism. And so what does it take?
So I'm a book person. So is there a book that outlines all this or something that I should look up?
Yeah, so I follow dietdoctor.com.
Dietdoctor.com. Okay.
Yeah, so that's an excellent website. They have YouTubes and so forth, a lot of educational training. There's a book called Why We Get Sick by Dr. Ben Bickman. That's all about insulin. And then
that one was a really good read. I read it twice. It has so much in it.
Yeah, you guys
you
get smarter than me.
You said Dr. Ben Beckman?
Bickman, Bikham, Bickman. And he also is on YouTube and Instagram. And Dr. Jason Fung is the obesity code and the diabetes code. And he really talks about, again, insulin as well. And
You said Jason Fung?
Fung.
F-U-N-G?
Yeah, and he's
Thank
really
you.
got a lot of information about intermittent fasting
Okay,
and the benefits of that.
thank you.
Of course.
See, now, one of the things that just because of my trade, I tend to, you know, I eat a breakfast in the morning, and during the day I'll eat some peanuts and nuts and stuff that I found that's seems to make my body happy during the day without eating carbs. And then, but I usually don't get dinner until 8 o'clock or so in the evenings. And I usually eat dinner and maybe do a few little things, and then I crash at night. And my body seems to, one of the things I found is if I actually stop and eat a lunch in the middle of the day, my body wants to go to sleep afterwards. I have about an hour and a half's worth of this time where I get kind of groggy and want to go to sleep. For some reason, my body likes to sleep after it eats.
Yeah.
And I don't know, am I?
Oh, I was going to comment to that. I think sometimes if we have carbs at lunch, sometimes they make it, I know carbs make me tired as well. And I think when we eat, so I don't know if your food was more protein and fats, if it would make us as tired after eating. But the carbs, you know, it has to do with, I think, the insulin rise and the insulin fall that tends to make us more tired. So. All righty. I want to thank you all for being here again.
And we thank you for being here. We appreciate this.
Yeah.
Yeah. I have a question.
Thank you.
I take ashwagandha and CBD to help myself sleep better. And you said sometimes medications become more efficient. Does that mean that you're more likely to overdose on things like supplements, you know, like CBD and ashwagandha?
Well, those particular ones, I don't think you would overdose on, but you can become more sensitive and may not need as much.
Okay.
I know when I switched to my vegan diet that's been helping my diabetes, all of a sudden the medications had way more effects. Because
Yeah.
I was, you know, getting my carbs, and but it for some reason, just when I switched the diet, I mean, it seemed like the medications had way more effects on my blood sugars and on my mood and all kinds of things. I know it's enough that my.
Was that with a vegan diet?
Yeah, he was doing a vegan diet. He does a vegan diet as well. And so I mean, vegan diet is when you're eating tons of vegetables will lower your blood sugar as well. I haven't seen,
Yeah.
yeah. I'm not a big fan of a complete. Terry,
I alternate. I eat.
Oh, yeah, he alternates. 1 week he'll do vegan, and then the next week he's not vegan. So that's the way he measures it. I'm not sure. Everyone has a way that works for them. But in general, I'm not a big fan of vegan because you can't get all the essential fatty acids and essential amino acids from that. So.
Dr. Joanne, thank you. This was very enlightening, and you gave me a lot of homework.
Oh, good, good.
You gave me a lot of homework. I have to get back to basics and behaving better. No more pizza, right?
Yeah, pizza's yeah, not the best. Maybe you could put
Can I tell you how to get a pizza?
How?
I found a recipe for a riced cauliflower crust, and it is really, really good. And it's just the riced cauliflower, an egg, and a little bit of cheese and a little bit of spices. And then you smear it all out and bake it 20 minutes, and then you add your toppings and sauce and meats and cheeses and bake it, and it's really good. Makes me think I'm having pizza.
Okay, well, you might have to like twist my arm, kick me in the knees. Anyway, nice to see you all. Good night.
Thank you so much, Crystal.
Bye.
All right, well, thank you, everybody. This was an excellent session.
Thank you.
Yeah, appreciate you coming, and we'll have one more next week. Okay,
Hey, thanks.
you're welcome. Thank you. See
Thank
you.
you.
Bye.